No, we've been reading some stories online, and it's mostly like, oh, I've had it, my mother has had it, and my aunt has it. Is there any chance that endometriosis perhaps is genetic or familial in nature?
Yeah, there is a genetic predisposition. If your mother has had it, you have a 10-time risk of developing endometriosis.
Wow.
And if your sister has had it, there's a 6-time risk of
Okay.
developing endometriosis. And it is said that it is linked to chromosomes 1 and 6, chromosome 1 and chromosome 6.
Okay.
Right.
And that's where the genetic link is,
Oh, wow.
especially in first-degree relatives
First
Wow.
degree, which is like your mother and
and your sister. That's right.
Yeah.
How do I know then if I have endometriosis? I mean, if I have cramps.
Yes, that's
right. I have cramps
Yes.
every month, and it's bad where I have to just be in bed
Yes,
all
yes.
the whole day.
So how do you differentiate it from normal cramps?
Yeah.
Is that
Yeah.
right?
Yeah.
So usually it's very characteristic. I mean, not always, but sometimes. You may have the pain before the onset of menses. You may have cramps. You may have backache. You may have even pain radiating down your legs, the inner thighs. And that is before the onset of menses. It peaks with the onset of menses, which is the onset of bleeding, and then it resolves as you finish bleeding.
Okay.
I see.
And then in some cases, you may have pain out with menses, i.e. After the onset of menses, and so in between periods, or maybe pain during ovulation, in the middle of the cycle,
Right.
pain during menstruation, but when opening the bowels.
Right.
Okay.
So recurring pain that is not normal. Then,
That's
I
right.
guess, right.
And not
Yeah.
resolved by simple measures.
Yeah.
Aromatherapy included, and exercise included, all these things included, but
Yeah.
not resolving, affecting your quality of life.
Right.
Exactly. And that's why I think this month, the Endometriosis Awareness Month is so important
Yeah.
because
Yes.
most women think that it's okay, it's normal to have
Yeah.
menstrual cramps, just stay at home or have a hot shower. But sometimes it's not just that. There's something more serious underneath all of
Yes.
that, like endometriosis.
That's
Now,
right.
doctor, in your opinion,
Yes.
why do you think endometriosis is more discussed in recent years than it was earlier?
Okay, that's mainly because of the fact that we're knowing more about it, and also women are delaying their childbearing.
Okay.
Okay, they're waiting, till their 30s and 40s before starting a family and things like that. So there's a delay in the diagnosis, and you're pushing your childbearing age later on. That I would say the most common reason why.
Okay.